Thanks. Thanks you guys so much. I was waiting for that to happen, but I wasn't sure if it was going to or not. But now that we're recording, we can get started. I'm just going to share my screen really quick. All right. So, hello everyone who is on the other end, and as well as, Antonia and Danielle. Abby and I are really, really excited to be here presenting to you all today. Today, we're talking about digital navigation and TAPs, or telehealth access points, tools, and partnerships for implementing healthcare access. My name is Jaleen Johnson. I'm the Assistant Program Director of the Northwest Regional Telehealth Resource Center. And I have my colleague with me, Abby Waldrup, who works for the National Digital Inclusion Alliance, and she will be giving a former introduction of herself in just a moment. But to get started, I just want to note that any information provided in today's talk is not to be regarded as legal advice. And that it's purely for informational purposes. Please always consult with your legal counsel regarding the topics discussed today if you have questions about legalities of things. And the NRTRC has no relevant financial interest arrangement or affiliation with any organizations or commercial products that may or may not be discussed in this program. So, to get started, I do want to just talk about the National Consortium of Telehealth Resource Centers. If you are joining this presentation, you are probably already familiar with the consortium. But in the case that you're not, the NCTRC is a collaborative of 12 regional and 2 national telehealth resource centers committed to implementing telehealth programs for rural and underserved communities. We pool our expertise to ensure technical assistance is provided with the best information possible. And we often collaborate to develop new tools and resources for the communities we serve. So if you take a look at this map, Antonia and Danielle are actually with the Upper Midwest Telehealth Resource Center over here. The NRTRC Northwest is over here. We cover Alaska down through Utah. But if you do not belong to any of those states, there is a telehealth resource center for every region in the United States. And again, like none of our information is really proprietary. Some of it is state focused, but you can utilize any of the information that we create. And like I said, we often pool expertise so that we're not duplicating any resources for you guys out there. I did also mention that there are 2 national telehealth resource centers. The first one being the Center for Connected Health Policy, or CCHP. CCHP is a nonprofit, nonpartisan organization working to maximize telehealth's ability to improve healthcare outcomes, delivery, and cost effectiveness. And then there's also the National Telehealth Technology Assessment Center, otherwise known as TTAC, and they aim to create better informed consumers of telehealth technology. And they do this by offering a variety of services in the areas of agnostic technology assessment. And TTAC really aims to become the place for answers that you have to questions about selecting appropriate technologies for your telehealth program. And then again, just a little bit more about our telehealth resource center in particular. We're funded by the Health Resources and Services Administration and the Office for the Advancement of Telehealth to serve the 7-state region of Alaska, Washington, Oregon, Montana, Idaho, Wyoming, and Utah. Our purpose is to advance the development, implementation, and integration of digital health services through sharing information, leveraging resources, and creating a synergistic telehealth community. I've put in here a few of like the highlighted items that we like to talk about. This one up here is a catalog of free telehealth training. Some of this is, state specific, but some of it's a little more broad. We have a great Telehealth 101 that actually has some free continuing medical education if you are looking for things like that. We have a lot about telebehavioral health, and then there's a few courses in there that I'm going to get into in a little more depth a little bit later. We have a great events calendar where we put up, free webinars and some conferences related to telehealth that you all can find, including this wonderful presentation today. And every year we also do a telehealth survey of the region and beyond to kind of see what the needs of our region are, and it's great data to kind of look at over the years. We started this back in 2020, and so to see kind of the needs change is interesting to see. You can see all of this and more at our website at nrtrc.org. Also, this QR code right here. But let's get into the bulk of the discussion today. And we just kind of want to level set by discussing how we just want to level set by discussing about better access to care by first talking about why things like broadband access and digital literacy are important to healthcare. Digital literacy and broadband connectivity have long been called the super social determinants of health. And that's really because they address all other social determinants of health. According to a journal from NPJ Digital Medicine, it was discussed that things like applications for employment, applications for housing, and other assistance programs, each of which influences an individual's health, are increasingly and sometimes exclusively only accessible online. And so access to information on healthcare and providers are increasingly being digitized by things like patient portals. And that really makes it difficult to manage your own healthcare without broadband access and technology. All of this really points to the fact that the cost of equipping a person to use the internet are substantially lower than the costs of treating health conditions once they become a problem. And so this makes the efforts to improve digital literacy and access to valuable tools like the internet and technologies increasingly important to everyone's healthcare management. For us at the NRTRC, there are two big models of support that we really see that promote health literacy and broadband access. The first is the digital navigator model, and I am not going to dive too deep into this model because that is why Abby is here. She's more of the expert on that. But to give just kind of a little bit of a preview, a digital navigator is a trusted guide whose role involves helping their communities build digital skills. These are people who can be digital navigators in and of themselves, like that is their title, but they can also and often do have other titles. For instance, positions like librarians and social service employees and community health workers. Many of you guys might be community health workers or work with community health workers. They often help their communities build basic digital skills to access, their healthcare information. But again, going to let Abby, who is the professional, get into this more. The other model, which I'm also not going to get into too much depth, since the last session, if you were on this last session, my good friend Samuel Carnes discussed it at length, is a telehealth access point or a TAP. So if you were not on this last presentation, which I believe is recorded and available for people to watch, to give you just kind of a high level refresher of what a telehealth access point is. The NRTRC defines a TAP as a dedicated public space for individuals to access a telehealth appointment. These spaces consist of three things: an adequate internet connection, usually about enough to stream a movie without interruption is about enough for most telehealth access points and telehealth platforms. The space includes a device with a working camera, speaker, and microphone, as well as some privacy considerations in the form of a dedicated room or kiosk where the telehealth visit can be conducted. TAPs can also have support staff like a digital navigator type role to assist an individual through the telehealth appointment or accessing digital health tools if needed. And TAPs really are scalable on many different levels. Some are going to be a lot more elaborate than others. You know, some of them have peripherals like an otoscope or a blood pressure monitor, different things like that. But really, like the basic necessities of a TAP are laid out for you in this definition. And again, that's the internet, that's the device, and that is the privacy considerations. So at this moment, for my end, I'm going to pause on this discussion and turn the presentation over to Abby to speak more about the digital navigator model and give a little bit more of an in-depth overview. Towards the end, we're going to kind of discuss some resources, sustainability models, and potential partners for this work. So, Abby, you are free to take the reins.
Hello, and thanks, Jaleen, for getting us set up with such a great intro. And I was also able to watch the last in the series of webinars, which I think is a great way to lead into this. So I hope you all were able to view that as well. But do let me introduce myself a little bit more. My name is Abby Waldrup, and I work for the National Digital Inclusion Alliance. I'm an associate director managing some special projects for us right now. And my background is in libraries and in digital navigator programs. So I'm happy to be able to talk to you all about digital navigator programs today. And I'm based in Durham, North Carolina. I'm not sure if I said that already. Our organization is fully remote and spread all over the country. So one of my coworkers may be nearer to you, but I'm happy to support folks all over the country. And just to tell you a little bit more about our organization and our role with this work, our goal is to advance digital equity by supporting community programs and equipping policymakers to act. And what that means is that we are supporting organizations and local communities primarily, but also organizations that work nationally, with their work to make sure everyone has what they need to get on the internet and the skills that they need to make use of it for their goals. We work by supporting the organizations that are doing that work and by learning from them. So we try to make opportunities for communities of practice, for people to talk to each other about what they're doing. We identify best practices and elevate those so that others can make use of those. The digital navigator model is a perfect example of how that can work to come together to create something really replicable and scalable for a variety of communities just by having folks who are local practitioners working together. We have affiliate organizations in all 50 states and in many of the territories, and we have 47 tribal entities that are members of our community. So the digital navigator model, just to focus for a moment on what we mean when we say digital navigator, we are talking about individuals who address the whole digital inclusion process, including home connectivity, devices, and digital skills with community members through repeated interactions. And that is a definition that was written by our community to define what this role does. And as Jaleen already pointed out, this can show up in a lot of different ways, but that is the basis that we use to kind of look if someone is trying to determine if they are a digital navigator or not, or if this role is partially doing digital navigation. This is what we're looking for generally. We're making sure that folks have, once again, the support that they need to reach their goals, whatever those goals are. So the model generally focuses on the goals of the individual community member that's being served by the digital navigator and making sure that whichever elements they are missing, they have support to get those. And digital navigators are generally available for repeated interaction. So people can build a relationship and earn trust and make sure that they understand that the person who's helping them is able to stick with them until they get everything that they need. So when I say everything that they need, we often look at three elements, kind of three categories of things that folks generally need support with to be able to use the internet for whatever their goals are. So the first of those is connection to the internet. This is where digital navigators are often helping people identify low-cost internet plans that are available if they qualify, different kinds of benefit programs that might support access to the internet, such as Lifeline, which provides mobile service support with a subsidy from the federal government. So affordable connectivity is really key here because cost is the number one reason that people don't have access to the internet. There are, of course, a lot of options for reaching the internet without having a home connection, such as going to a public library or, in this case of taps, there may be certain equipment that someone may not have at home that they aren't able to connect to the internet at home using that, so they may use public spaces to do that. But affordable broadband is generally one of the things that people may need support with. The second is having affordable, appropriate devices that meet someone's needs. So many people have a cell phone these days, a smartphone, and that is going to be really useful for a lot of tasks. But if someone is hoping to begin a job working from home or is going back to college online, they're going to have a lot of trouble completing a lot of tasks on that smartphone. So that person may, for example, need a large screen device, a laptop, something with a keyboard. So a digital navigator partners with individuals to help them figure out what kind of device might be the best fit for them, and then again, find something that is going to be affordable for them and work in the ways that they need it to. So it's always a balance between what's most affordable and what's most functional. And there are device refurbishers, a lot of nonprofit device refurbishers that can provide access to affordable devices. That's one example of how people are able to access affordable devices. And then the final section of resources is digital skills support. And these are all elements that have been provided in pieces in communities for a long time, and they may be available in communities now. There may be, for example, tech classes at your local library, but an individual may need help finding which tech classes fit them best, or may need individual hands-on support with learning a specific skill, and so a digital navigator comes into play by connecting the options for affordable broadband, appropriate devices, and digital skills support all into one role. Digital navigators do not always directly provide the support, but they are kind of a hub for all of these resources. So a digital navigator will meet with an individual and talk through what their goals are, what assets they already have. Do they already have home internet? Do they already have a laptop? Are there certain skills that they already are bringing to the table? And then what is the gap for what they want to be able to do? What will they need? And then this is where programs have the most differences, will be how they meet those needs. So some digital navigators will provide direct support on all three of these things. They may be really familiar with, for example, low-cost internet plans and help people identify which one fits them best. They may have a relationship with a refurbisher where they can directly provide low-cost devices, and they may have the time and the flexibility to teach skills one-on-one to give this person what they need. But in many cases, all three of these may not be provided directly by the digital navigator, but they may refer an individual out. So if someone wants to learn how to use Excel for the kinds of jobs that they want to be able to apply for, there may be somewhere that they can take a class about Excel in the community. The digital navigator would know about that and then help someone sign up for that class, check in and make sure that's working for them and get them everything that they need to make use of that. So a key piece about the digital navigators is that they are prepared to connect people to all of these resources, whether they directly provide them or not. When we're thinking about what a digital navigator is helping people to be able to do, we usually think about technology. We're usually thinking about computers, we're thinking about the kinds of online resources or applications that people need to be able to use. We're thinking about innovations, like what's new, what people may need help learning how to do. But when we're thinking about who a digital navigator is, technology is not the first thing we think about. We don't think about hiring like an IT professional or identifying an IT person who can do this kind of role. We look at some of the soft skills, some of the people skills that are really necessary to be able to communicate well with the people who need support. And we think that most of the technology parts are going to be things that people can learn on the job or can kind of train up on and skill up on. There is, of course, some basic technological concept. Understanding those would be really helpful, and that can be a good place to start. But we've also seen examples where people who were receiving help from a digital navigator maybe a year ago are really great digital navigators because they have a level of empathy and understanding of where someone's coming from, and also the ability to talk about things on the level of someone who's learning, where someone who doesn't have an experience of learning new technology recently may have trouble speaking about it in a way that's understandable to someone who's learning, just as an example. So this slide shares some of the qualities of a digital navigator that people are often looking for when they're hiring or identifying digital navigators for their organization. The number one item for this is members of the community that they serve. That is a really useful way, a kind of a shortcut to get some of these other qualities that we're hoping that digital navigators will have. So if they're empathetic, they're culturally competent, if they're able to communicate well with a community that they are already from, then that's going to help them be able to build trust and relationships and be available to the people that they're trying to support. We also believe that good digital navigators are patient. These conversations can take a long time. They're reliable. They're also flexible and adaptable to be able to kind of learn alongside the person that they're supporting if there's a skill that they're not super familiar with, or if someone's goals change as they're working with them. And we often say, good humor just to keep the relationship light and moving forward is often a little bit helpful as well. But you'll see, really excellent customer service skills and problem solving are the kind of things that a digital navigator really excels in. We have some resources. I'm going to share resources throughout, and then we'll get you these slides, I believe, so you'll have these links. So some resources related to hiring digital navigators that we have available are a baseline job description that was created by our community that kind of gives a lot of examples of the kinds of things that people are often looking for, and then some interview questions if you're hiring a digital navigator or even selecting volunteer digital navigators that might be useful for those things. And then, as I mentioned, there's a level of training that we think makes a good digital navigator, and really prepares people for the most success, both as a digital navigator and for their community members. And these are the areas that we typically begin training in. And those are, an orientation to some of the things we've already talked about, an understanding of the needs that people may have for skills, devices, connectivity, why those gaps exist. So that's kind of where we begin. And then some training on the audience that they're going to support and their needs, which may be different for different organizations. As I mentioned earlier, many of our affiliate organizations are focused on supporting people to get access to the internet and the skills they need to be able to make use of it. But we also have a lot of affiliate organizations who have other primary goals, which might be getting people good healthcare or in good health. It might be getting people employed or preparing people to continue education. And it also might just be, I shouldn't say just, it may also be social goals, making sure that people are connected to their communities and being able to communicate with their families and that sort of thing. So if those are the primary goals of an organization and they have a digital navigator as part of that work, they may need to understand a specific audience that they're working with in the context in which this organization interacts with those people. Additional training would be asset mapping, which is really where a digital navigator builds a strength of knowledge of what resources are available for all those referrals that they may be making. And just having a familiarity with what resources are available and how to access them is a huge asset, which I know many of y'all will understand that, as many resources are often available for a variety of things. There's also many complicated layers to accessing those resources at times. So just having the digital navigator be a partner who understands what resources are available, who they might be a fit for, and how to overcome the barriers to access is really one of the biggest adds that a digital navigator can bring to their work. And then, of course, evaluation and reporting is a part of most programs, and we think digital navigators need to be prepared as those who are most closely interacting with community members to be able to report back on what success is looking like in their program, what kinds of resources they may need to be able to support people better, and also, of course, any kind of reporting that you may have for funders, which will just demonstrate the value that they're bringing to the work that they're doing. And we have additional training topics that are really useful for professional development for digital navigators, which would include accessibility options, options for, or understanding of how to teach adults, adult education. That's really sort of a bonus set of skills that a digital navigator can have when they're working with educating adults in sort of this informal way. And then boundary setting is really important, which again, I think many of you will understand when you are working alongside someone to reach very personal and important goals for themselves that sometimes keeping on track with that conversation on the kinds of things you're meant to work on together can be a really important part of being successful in these roles. So training can happen in a lot of different ways. I have listed four here on the slide, different trainings that are provided by different providers, including us. NDIA has a training that we provide in a variety of ways to groups or individuals, and we also have a lot of our training materials publicly available if you want to kind of see what that looks like. And then Digital Lift, World Education, and Marylanders Online are three affiliates of NDIA in our community who also do great trainings and have a lot of resources available. What does the staffing look like? That's a question that we sometimes get. So I just wanted to give you a few examples of that represent the variety of ways that digital navigators exist in the world. It's really a flexible model. It's been adapted for a variety of situations. But these three examples show that it works depending on what's needed in each organization. So we see in New York libraries, there are over 150 staff that already work in libraries that have received additional training to provide digital navigation. That was a really good fit because these were people who were being asked these questions anyway by the community and having interactions that were very similar to digital navigator interactions, but with a little bit of additional training, they were really able to make those more impactful interactions that they were having and help people become independent with what they were doing rather than just answering individual questions one off over and over. So that was a great model that I think could work in a lot of different settings where frontline staff are asked, how to reset passwords frequently or, how do I access this online resource that moving them into the mindset of a digital navigator, giving them the flexibility to provide a little more in-depth support can really amplify what they're able to do with the folks that they work with. Uh, Moving on into San Diego, they hired 13 interns that were embedded in community organizations. I think a lot of success of this model was centralized support, training, data collection by the city. But then those interns were input into community organizations that had a lot of trust in the community and were able to really reach community members in a better way than the city would be able to as like a larger entity. And then finally, full-time staff is a really great model for digital navigators. And we had the National Digital Navigator Corps, in which organizations in rural areas and in areas that serve tribes each hired a full-time employee that was just the one single dedicated digital navigator for that organization. Speaking of organizations, what kinds of organizations host digital navigators is also varied. Uh, the main thing is that digital navigators should be based in trusted organizations, and we know different organizations have different trust in different communities. As I said, my background's in libraries, which are highly rated for trust frequently, but there are certain individuals and communities and demographics that have less trust in libraries, especially when and the ways that they are connected to the government. And so, even if a library is a great place for a digital navigator for most people in a community or many people in a community, it may make sense to have digital navigators in other organizations across the community where other trust is based. And trust can also be leveraged in partnerships. So, if there's a certain kind of demographic that you're hoping to reach, let's say there's a certain demographic that you would like to see use patient portals more often or have better access to telehealth, then you may think about partnering with an organization that maybe already has a digital navigator in a certain community that has that kind of trust and provide that extra support to be able to make the outreach in that area. I just want to share a couple stories very, very quickly that demonstrate why this model works well. The first is highlighting how one-on-one interactions mean that people receive the individualized support that they need. And in this example, we have Christina, who had attempted to learn about computers in the past, but it just had not worked for her. But she eventually was able to partner with a digital navigator who was better prepared to speak to her in a language she understood. She said she doesn't think her previous interactions worked because she said, I don't speak computer language. But her digital navigator was able to speak to her in a way that she understood. And in the end, she said the computer is now a friend, which was very sweet. But that kind of one-on-one support wasn't happening for her in classes or in groups that she had attempted to learn from before. So a digital navigator was really the only way she was able to get that, make that kind of progress. And then I wanted to highlight the repeated interactions as a key element for building trust and the human connection. People often struggle to get started learning new things on devices when it feels really impersonal, and so having a human that they can talk to and work through it with is really um, important for building confidence and also just to help people stay on track with what they're doing. And so these digital navigators were able to support these clients through more than one interaction by being there for them, week after week, over multiple meetings, whether there were other resources they were learning from or not, they had a person they could come back to stay connected to that work. Most of the resources that I shared are available on our website, and that was a very quick introduction. We have a longer webinar that you can watch if you want to get more in depth with some digital navigator examples and models. But you can also access all of those resources at digitalinclusion.org/DN. And we have so many more resources to go through. I'm going to pass it back to you, Jaleen, um, to share some of the resources you've brought.
Thanks, Abby. Yeah, and I just wanted to also stress the qualities that you mentioned of a digital navigator. I mean, I think that's so important. I mean, especially on the healthcare side too, because not only do people not always trust technology, but they don't always trust healthcare either. And so mixing the two together kind of creates this perfect storm of I'm just going to give up and walk away. So having resources like this really, really stresses the importance of that person who is teaching to be a trusted member of the community. So thank you so much for mentioning that. So from our end, we're also going to jump into some resources. A lot of what Abby was talking about is great for starting in the digital navigator field. But as we at the NRTRC kind of started learning about the digital navigator model, we didn't really see a whole lot of resources for healthcare or telehealth in digital navigation. So what we did was in the fall of 2022, we developed a course that is available in that catalog that I referenced at the beginning of the presentation on our website, called Navigating the Telehealth Neighborhood, a training on telehealth access for digital navigators. The course itself was created for digital navigators, and we had that in mind. But it's really a great introduction for an introduction to telehealth and digital health services for anyone assisting a learner, patient, or loved one in accessing telehealth. We subsequently created a digital navigation toolkit in partnership with the National Consortium. So these tools really outline the baseline resources available to help those assisting others with digital health programming and learning about telehealth basics and virtual appointments. And both of those are available to access. We often reference a lot of the resources for digital navigation in general in these courses as well. One of the first feedback that we got from the first course was, hey, do you have something like this for patient portals? And we didn't at the time, but we were thinking that that was such a great idea that we decided to develop one of those as well. And so our new-ish, I should probably take off the word new because it's been live for about a year now, but our new-ish course is on patient portals. So if you aren't already familiar with what a patient portal is, it's one of those apps on your phone that you can utilize to refill a prescription, to contact your provider, to change or schedule appointments. Patient portals are really the most important frontline tool for managing and taking ownership of your own healthcare. Tools like these provide healthcare data and again, access to healthcare providers to find answers to pressing questions right at your fingertips. This training provides the intro to patient portals. And then in section 2, we have a bunch of really great, clear workflows. We have some user guides and tutorials, some troubleshooting resources, and then privacy and security information, digital literacy support materials, and all kinds of information about different EHRs. Um, as a consortium, we were able to collaborate and create some really fantastic tools for that training. And this took a little bit of asset mapping of our own because what we found, and being HRSA funded, we remain vendor agnostic. So the training itself had to be kind of vendor agnostic as well. So there's a lot of different patient portals out there. The most common one that many have seen is probably Epic MyChart, but then you have Cerner Health, you have Athena Communicator. There's a bunch out there, and there are some really great resources that are publicly available from these companies that help you troubleshoot. But what we found as we were building this training was that they are super hard to find if you don't know where you're looking. So as a consortium, we kind of we put together what we could find of probably like the top 10 patient portals, and put it together all in a document with hyperlinks so that people who are assisting others can find tools that they need to troubleshoot. We also did the same thing in creating kind of a quick guide of what the patient portal functions are for those most commonly used patient portals. Just noting which ones have video, which ones have messaging, which ones you could pay your bills on, different things like that. And then we also created this great like point and learn guide. So if you're assisting someone with accessing a patient portal, sometimes they don't always have the right terms to like communicate what they're trying to do. Or, maybe they need some materials translated for them. I will tell you a lot of the patient portals, which is a huge problem, do not come in many different languages. And so if you're helping somebody who's maybe speaking another language, this document can kind of help them figure out and help you figure out what they're actually trying to accomplish within this patient portal. And all of these and the trainings are available online. They are self-enrolling, they are go at your own pace, and 100% free. So you can train yourself, or you can utilize those trainings to help your staff upskill on some of those items. I also wanted to point out in terms of TAPS resources, and I can't remember if Samuel mentioned this at all in the last presentation, was that we have a really great map for finding telehealth access points. The map that we have is the NRTRC Find Telehealth Map. And it originally went live in 2021 and started as kind of a mapping of facilities across the Northwest that provide healthcare services. And that includes in-person services, telehealth services, and both. We were also able to partner with the Southwest Telehealth Resource Center to add their states to that map in the last couple of years. So we started using it as a tool for patients and providers to see what facilities provide telehealth services in the Northwest and Southwest. It's searchable by area, radius, by location, and of course by specialty. So if you're looking, for a nephrologist 25 miles outside of Boise, Idaho, that maybe provides both in-person and telehealth, you could find that on this map. But towards the beginning of 2023, we kept seeing these TAPs pop up more and more. And we thought, wouldn't it be great if we were able to start mapping those as well, so that people coming to the map could find not only the healthcare that they were looking for, but a place to maybe have a telehealth appointment in the case they didn't have that at home. And we were actually able to make that layer of the map live for the entire United States. So while that facility mapping portion of the map stays in the 11 states that the North and Southwest TRCs cover, you can map and also locate any taps that we're aware of on this map. There's a great little instructional that I can provide, to everybody afterwards if you guys want to take a look at it. The map can be kind of confusing just because the facilities for some portion and the taps is for the whole US. But if you want to see if there's any taps in your state, you can certainly go activate the taps button, see what might be available. If you're providing a tap and you want to get it on the map, there is an easy little form that you could fill out to get that on the map, and it usually populates within the week. So there's also a really great telehealth access points best practice guide from the National Consortium of Telehealth Resource Centers that people can access if you're thinking about maybe developing one at your organization. And then, of course, the last thing that I want to talk about is sustainability and funding for digital navigation programs and TAPs. These resources have proven time and time again to be so, so valuable for their communities. But the funding programs, that are available don't always match that need, and especially in terms of digital navigation. Considering that technology changes like literally every day, funding and long-term funding can be really, really hard to find. But we do have a few ideas on the slide that might help you get started if you are interested in engaging or upskilling maybe some of your employees to be digital navigators. I wanted to talk again about community health workers because, again, they are really doing a lot of this work already. And community health workers are a really, really great staple because, again, they're that trusted guide and they are community members. And they're often trained up to be, digital navigators in their own right. I will say that the University of Massachusetts did this great 50-state scan of Medicaid payment for community health workers. This kind of draws out which states actually have reimbursement to make a community health program or a community health worker program sustainable in the long term to have continuous funding. This resource was from 2024, so it might not be as accurate as it should be. There have been a lot of changes to CMS and CMS reimbursement over the last year and a half specifically. So you could take a look at that resource, maybe see, dig a little deeper, contact your local CMS office, see if that's something that is available. But it is a great kind of overview of the community health worker model and how valuable it is. And then, of course, whether or not there's some payment if you guys want to take a look at that. But the next, more current resource that I have in here is again the Centers for Medicare and Medicaid Innovation Office Rural Health Transformation Program. It's a mouthful. Some of you guys may be familiar with this already. There's been, if you are, in the public health community, we have talked a lot about this Rural Health Transformation Program. There is funding coming down the line, and I'll just refer to it as RHTP because again, it's kind of a mouthful. It's a $50 billion program being allocated right now to approved states over the next 5 fiscal years, with $10 billion in funding being available each fiscal year, beginning in this fiscal year, FY26, and ending in FY2030. 50% of this $50 billion is going to be distributed equally amongst all the states that have an approved plan. And then the other 50% is going to be allocated by the Centers for Medicare and Medicaid Innovation based on a variety of factors, including the amount of rural population that you might have, the proportion of rural healthcare facilities in the states, certain situation of hospitals in the state, and other factors that are yet to be determined by CMMI. On this slide, there is some resources in there if you want to learn a little bit more. The CMMI Rural Health Transformation Program overview that you can find, and then also a great state by state RHTP overview from the National Rural Health Association. This program is already in progress of being deployed. It has happened very, very quickly. All the states have already sent in the applications for FY26. Most of them at this point have been approved, and most of them have received the funding for the first year. And they do need to spend that down by the end of August. Many of for the first year of funding, again, it's a 5-year program. Many of the plans, I mention this because many of the plans include a bucket of funding to upskill the workforce in each state and get patients and providers in rural areas more acquainted with technology in healthcare. And because it is happening so quickly, we have definitely been advising rural health partners to reach out to organizations like the NDIA and other more local partners to work with existing entities that support digital literacy programs in their communities. And I think Abby has a little bit more to say about like partnerships. So I'm going to pass the mic back over to her to talk about the rest of her resources and partners in digital navigation.
There are lots of people who want to partner with you on this work. So that's the good news. I mentioned earlier a large number, and if I try to quote it now, I may be mistaken, but a large number of organizations that are in NDIA's affiliate community who are doing this kind of work locally and are already familiar with the resources that are available in your community, with the kinds of barriers that folks are running into with doing things online and getting access that works for them to reach their goals. So you can certainly reach out to them to build partnerships to help work together. You don't need to necessarily start from scratch with asset mapping and kind of learning how to meet these needs because there's already organizations that are doing it. I see, have already seen in the chat and in the participant list that some of those great partners for you are already here as part of this conversation today. So glad to see you all. You can go to digitalinclusion.org/affiliates to see this map, which there's a screenshot of on my slide, with all these little dots all over the United States where NDIA's affiliate organizations are. And again, these are all completely independent organizations that are working, primarily working locally to support their communities in different ways. So that is a great way to get started if this is something that you want to get your organization to get more involved in. You can reach out to them. As Jaleen pointed out, the funding is the biggest challenge for keeping these digital navigator programs going, but there's already a wealth of expertise that you can certainly tap into to really get going quickly with a program that would meet some of these needs for your community. So I would definitely recommend reaching out to affiliates in your community to determine, is there already a digital navigator program happening that you can partner with? You may be able to, refer people to that organization if you are working with someone who is running into some challenges with accessing telehealth or health patient portals or anything digital to do with their health. You may also have resources that you can provide to them. You can help them understand how to better support people with accessing the kinds of resources that you provide, since they're already going to be getting these questions. So I definitely recommend reaching out to these affiliates to determine if they have a digital navigator program or other kinds of programs that are getting people online, getting them the skills that they need. That might be a good relationship for you to begin building. If you want to see specifically digital navigator programs, we have a different map, which is just lists those digital navigator programs. There are lots and lots of digital navigator programs that are not on our map. This is an opt-in, and there are a variety of reasons that people have chosen to get on this map or not, but it's a good place to start. So digitalinclusion.org/TN, where all those resources are. At the bottom of that page, you'll see a map of digital navigator programs there as well. And you are also invited to join our community and be part of these conversations and become more well acquainted with some of the issues and some of the models that folks are using to address these issues. It's free for nonprofits to become an affiliate organization. We have a very active and interesting listserv. I know listserv is not the most exciting term to hear, but it is one of the best assets for learning about this work. And when resources are available, that's where we learn about them first. And it's also a very supportive community. So if you have a question, people will be very quick to answer it, even if you may not be, you're probably not the first person who's asked this question on the listserv, and folks are very friendly and happy to point you to resources that already exist. So that can really save you a lot of legwork sometimes. And then we have community calls monthly where we have presentations on topics such as the rural healthcare transformation program. We recently had presentations on that, so it's a good place to stay connected to what's going on. So would highly recommend joining our community if this is a topic that you feel is important to your work. And you can always mute the listserv or put it on digest mode or send it to another folder if it's too much, because that's what I have to do in my inbox. If the digital navigator work is specifically interesting to you, we do have a subgroup, a working group that just talks about things going on with digital navigators. Primarily, these are people who are connected to an active digital navigator program, either digital navigators themselves, or their supervisors, their program managers. But if you are wanting to explore starting a digital navigator program or learning more about partnering with them, you're certainly welcome to also join. You can listen in and stay a part of that as long as it's useful to you. And that's the group that develops a lot of the resources we share and answers questions when we have them about what's going on the ground digital navigator programs. And then finally, I want to mention our conference next year is going to be in Columbus, Ohio. We're excited to go to Ohio, which is where NDIA was founded and where our executive director still is based in Columbus, Ohio. So it's going to be kind of a hometown conference for us this year or next year, and we're looking forward to that. And so we really would invite you to think about joining us there. It's a great conference. It's very approachable and very practical. Resources are shared. Telehealth is always an important topic. There's always multiple sessions on telehealth and on health support. And so that certainly will be something we're talking about. So if you want to get to know some of our community in person, would highly recommend joining us next year at that conference. I believe that brings us to a few minutes for questions. And we also have a couple of email addresses on the slide that if you want to reach out to us afterwards, you might be able to get a hold of us there. Jaleen, did I leave anything out?
No, I think we did awesome. I will
I would
just say
agree.
I will just say too, the conference that Abby mentioned, I can't recommend enough. I have been lucky enough to attend that for 3 years in a row. I wasn't able to in the last year, but if you are looking to maybe connect with some of these programs in your state or region, they're very, very good about networking, within the local partners. Um, Everybody is really excited and fun and happy to be there. It's very, very energizing and just a great place to be. Also, very, very affordable. I can't recommend it enough. So please feel free to look into that.
And we have information about our CEUs here available on screen. But please, if you have any questions, go ahead and ask those to our speakers. There was one in the chat that I actually placed there about creative ways to fund digital navigators. And Heidi, I don't know if you're still on the call, but she did say that they've utilized AmeriCorps programs to recruit and train digital navigators. You guys have mentioned rural health transformation. I didn't know if there's anyone else on the call that has a creative way that they've funded or thought of funding digital navigators, or maybe Jaleen or Abby, if there's been something that's cropped up in your time doing this that, oh, maybe community foundations or something like that.
Those are all great examples that you pointed out. And as we mentioned, funding is the most challenging part, so it's a great question to ask. I would also mention, we briefly talked about people who are already in roles that, funded jobs that are doing some of this work. I think there's a real argument to be made for the efficiencies that this would add if they are able to get a little more training and have a little more time in their roles to really support people to become more independent with their digital skills. That's a way that we have seen, for example, in libraries. If I teach the same, or if I tell the same person how to reset their password every week, that's going to take 20 minutes every week. But if I spend an hour teaching them how to do it, that's going to become more efficient, my job. So those are the kinds of arguments people have been able to make to be able to carve out a little more time to do some of the digital navigator training and work in a current role.
Absolutely. And I have a question that the wheels are spinning as you were answering, because Jaleen had mentioned community health workers. Has there ever been a collaboration to create a community health worker training on digital navigation that they could do self-paced, that was module based to kind of help them get that training along with their community health worker certification?
So I think that that's a great idea, Antonia, and it's something that we've looked into. The digital navigation training that we have, we've definitely been pushing out to community health workers in our region. It is, like I said, created with digital navigators in mind, but is really, really applicable to a lot of different roles. And so because, it's free and we're able to get that out to people, it has worked. One of the things that we've really liked to look into, haven't quite yet, is accreditation for community health workers, right? Because that helps, I think, those types of roles uh, gain, the different resources that they need for certification. It's why some of our trainings do have some like free continuing medical education credits. We just haven't quite gotten there yet. And of course, like for that type of program, we would look into any type of special accreditation that we can if it were available. Haven't quite gotten there yet. I will say, I think the Northeast Telehealth Resource Center has a lot of great community health worker trainings. And again, those are very, very digital health, telehealth focused. So there's a lot more resources out there amongst the TRCs that we can look into. And again, if you're interested in knowing some more about those, I'm happy to connect you with some of that as well.
Fantastic, thank you. And Heidi added another possible ways to encourage public health grad students to pursue internships that do this kind of work. She believes University in Long Island did something like this. So that's exciting.
Mm-hmm.
And Heidi did drop her email in the chat if anyone wants to know more about how her organization is funding digital navigation. So please reach out to her. And Heidi, I might reach out to you as well. I think it would be great to network and learn more from you. Any other questions from our attendees? Okay, I'll hand it over to Danielle to close us out.
Yeah, just a quick reminder, this session has been approved by the National Association of Social Workers. That's our Indiana chapter for LSWs, LCSWs, LMFTs, LMHCs, LACs, and LCACs. Lots of acronyms there. So participants will receive information on how to claim their credits in follow-up communications. So these CEUs are approved for Indiana and Ohio partners as of now. If you do not want to claim a CEU, that's fine, but this training may also be eligible for Category 2 continuing education, which is self-directed. So check with your state about eligibility there. So for participants to be eligible to claim their CEU, they need to do the following. So they need to complete the post-test assessment and pass with 80% proficiency, and then complete the UMTRC webinar knowledge survey. So there are links to both of these on screen right now through QR codes, but we will be sending out a follow-up email probably tomorrow before lunch with the link to the recorded the recorded webinar and more information about this. And then we also would encourage you to join us for our next webinar on May 6th. That's what's it called? A registration link right there. Beyond that, Jaleen, Abby, thank you so much for joining us today. We really appreciate it. And yeah, if you have any more comments, questions, concerns in the meantime, please let us know. We would be happy to forward those to the appropriate person. Otherwise, we'll stick around for a few more minutes, but then I think we will stop for today. So thank you so much, everyone, for attending.
Thanks
Thank
for
you
having
again,
us, you
Jaleen and
guys.
Of course.